Childhood headaches are a very common cause of pain in children. In fact, in my clinic, on a daily basis, I see at least 20 to 25% of children with headaches. The prevalence of headaches in childhood is up to 50% in children less than 7 years and up to 80% in children under 15 years of age. Childhood headaches have to be managed very carefully because it is very under-recognized and underdiagnosed. So any child who has headaches has to be seen by a child neurologist as soon as possible so that it can be dealt with effectively. You'd be surprised that childhood headaches are so common, and the presentation is exactly like it is in adults most of the times. There are different types of childhood headaches, and the most common ones are migraine headaches, tension headaches, chronic daily headache, and a rare condition called paroxysmal hemicrania. Some of the kids also get what we call as chronic daily headache, in which the headaches happen on a daily basis. Out of all these, migraine is something which is very common in children, and they classically present with one-sided headache with a visual aura, in which they sometimes get blurred vision, nausea, vomiting, photophobia and phonophobia. So it's very important that the child neurologist delineates which type of headache the child has got, because the treatment can vary amongst these headaches. Managing headaches in children can be very tricky at times. It's very important to take a good history in the beginning and see if we can define what kind of headaches the child is having. Then you go for something called a non-pharmacological treatment first, which includes drinking plenty of water, avoiding any triggers like caffeine, chocolate, etc. And then if the child is having any red flag signs, for example, vomiting at night without reason, we may have to do neuroimaging as well, like an MRI scan. The child also may need help from other disciplines, for example, psychology and dietitian. So collectively, we can all work together and help relieve the symptoms of the child of the headache.